Times vaccination leaders answer with the COVID-19 questions. Over the weekend, we asked the Warrington Guardian readers on Facebook what questions you would like to be answered regarding coronavirus and the vaccine rolled out in Warrington. We listened and took your queries to the people tasked with delivering the vaccine to residents across Warrington. Dr. D.B., GP, and clinical director and clinical director of the Howell Jones vaccination site, the Dr. L.M., GP, and clinical director of the OJH vaccination site have generously took time out of their busy schedules to answer your questions. Here is what they said. Question: why aren't supermarket staff being vaccinated? We see hundreds of different people every day who could be spreading COVID-19 with no symptoms, and then we have to go home to our families. Answer: we understand that many people are anxious and keen to get the vaccine as soon as possible, so both they and their loved ones are protected from the virus. Supermarket staff provide a vital role. Vaccination teams have to follow the guidance and rules that are set out for us by the NHS. Vaccinations are being delivered according to priority groups identified by the Joint Committee of Vaccination and Immunization. The JCVI states the priority is to minimize COVID-19 deaths as much as possible and to protect our health and social care staff and system. Evidence shows the older you are, the more at risk you are from COVID-19. So the vaccination rollout to patients is based on age. Questions: what priority groups are being vaccinated at present? Answer: locally, we have been working incredibly hard to roll out the vaccination program, and we are on target to have over the first dose of the vaccine to everyone in the top 4 priority groups by next week. This includes care home residents and staff, residents over 70, frontline health and social care staff, and people who have been struggling and classed as clinically extremely vulnerable. Question: when are vaccinations for the over 60s likely to start? Answer: very soon. Once we get the permission, we will start to invite residents over 65 to be vaccinated. Please be reassured that you will be contacted when it is your turn to book your vaccination. Please be reassured that you will be contacted when it is your turn to book your vaccination. Some practice will call and some will send a text. Please remember that the NHS does not charge for the vaccination. And question: why are we vaccinating young healthcare workers before clinically vulnerable? Answer: patients facing health and social care staff have been prioritized because they are more at risk of exposure to the virus. Also, protecting health and social care staff from the virus also helps to protect the people they care for too. We are pleased to say that many local healthcare workers have already been vaccinated, which will protect our vulnerable patients. The staff will still need to be thinking hands, face, space at all times, wearing the correct PPE and washing their hands regularly. In Warrington, many clinically vulnerable people have already been vaccinated, but if you believe you should have been vaccinated already, send an e-consult online form on your practice website to your GP and ask them to double-check your medical records. Question: why is there loving in praise for sheltering people's families? They have to go to work every day with the fear of bringing the virus home. Answer: we understand it has been a worrying time for anyone who is sheltering or their families, but all local patients who are clinically extremely vulnerable should now have been offered an appointment for a vaccination. If you are still waiting for a vaccination appointment, please contact our GP practice. As stated above, the decisions about who should be prioritized for vaccinations are made nationally, and at the moment, people living in a household with those who are extremely clinically vulnerable are not included in the top priority groups, although in some cases family members may be eligible in their own right. Question: I am classed as vulnerable person who suffers from type 2 diabetes and chronic pain. How long will it be before con- I am contacted? Please be reassured that you will be contacted very soon. We are trying to get through each priority group as quickly as we can. Please make sure you look after yourself, follow the national rules, and, of course, think about hands, face, space at all times. When will foster carriers get their vaccine? We are awaiting national guidance on foster carriers, but when we have more information about this, we will let families know. Why are we not vaccinating teachers and kids so they can return to school? This is not a decision that is made at a local level here in Warrington. The NHS is currently prioritizing vaccinating those people who leading national experts have agreed will benefit from it the most. We are totally committed to vaccinating all groups that we are able to as sweaty as possible, and this includes planning as groups such as this when the time comes. This is not a decision that is made at a local level here in Warrington. The NHS is currently prioritizing vaccinating those people who leading national experts have agreed with benefits from it the most. We are totally committed to vaccinating all groups that we are able to as ready as possible, and this includes planning as groups such as this when the time comes. When will people who look after their vulnerable partner get their vaccine? Vaccination centers have to follow the rules that are set out for us by the NHS. Many people who are unpaid workers looking after loved ones will fall into priority group 6. Adults in at-risk groups and carriers. Carers. We are about to move to vaccinate priority group 5 and hope to finish that group by the end of February. So it will be early March that we start to vaccinate people in at-risk group and carers. If you are a full-time carer of an elderly, disabled, or vulnerable person, and your GP practice is not aware, please contact them to let them know. Many carriers may be in a group higher up the list due to age if they are over 65. Why is the vaccine not available for extremely clinically vulnerable children? The vaccines are not currently approved for children under 16. Further trials and studies are needed to ensure that the vaccine is safe and effective for children. However, there has been some further clarification from NHS England on which children aged between 12 and 16 on the clinically extremely vulnerable shifting list could be called. Practice will contact families where this applies. However, it is important to state that almost all children with COVID-19 have no symptoms or mild disease. Is it true that you can still pass on COVID-19 after having the vaccine? While 2 doses of the vaccine will reduce your chance of becoming seriously ill with COVID-19, we do not yet know whether it will stop you from catching and passing on the virus, but we do expect it to reduce this risk. So it is still important to follow the guidance in your local area to protect those around you, to protect yourself and your family, friends, and colleagues, 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 colleagues,
colleagues,
colleagues. To protect yourself and your family, friends, and colleagues, you still need to practice social distancing. Wear a face mask, wash your hands carefully and frequently, and follow the current guidance for where you live.